Ketotic hypoglycemia, or KH, is a medical condition involving low blood glucose and production of ketones in the body whose symptoms may include fatigue, unusual sweating, behavioral changes, vomiting, overeating, and seizures. KH can often go undiagnosed and untreated because these symptoms are common in other ailments as well. A unique research group of patients, caregivers, and medical experts, united in the patient organization Ketotic Hypoglycemia International, has now uncovered that KH may be common in children with Down syndrome. Their findings motivated them to launch a web-based survey, which indeed confirmed that symptoms of KH manifested frequently in patients with Down syndrome and can often go undiagnosed. For example, Austin Carrig, co-author of the study and mother to Melanie, a patient with Down syndrome and ketotic hypoglycemia, explained that her daughter's symptoms were not diagnosed as KH for years. As to why KH manifested frequently in patients with Down syndrome, the researchers refer to a recent study involving mouse models, which revealed a metabolic pathway establishing a relationship between Down syndrome and KH. The study highlights that patients with Down syndrome who show symptoms like lethargy, failure to thrive, vomiting, irritability, or overeating should be tested for KH. Treatment with cornstarch, protein, and frequent meals can prevent symptoms of KH and may lead to improvement in mental and physical growth. This is the first study to highlight a suspected high prevalence of KH in patients with Down syndrome. To validate the findings of this research, there is a need for funding for further studies to establish the prevalence of KH in Down syndrome, as well as uniting medical experts in trisomy 21 with the authors of this research paper. This research process is an example of how a research ecosystem fostering patient partnership could be practiced, built upon a foundation of co-creation and empowerment of patients and their caregivers. In this specific research process, it has been the caregivers who identified new disease patterns on social media, with which the medical experts on board then accelerated to a meaningful multi-stakeholder co-created research process.